Well, hello, good morning, happy Sunday. Welcome to Sunday Morning Coffee with Dr. Childress. Today I'm going to be discussing treatment related issues uh, relative to the attachment pathology in the family courts. The treatment over here in the family courts is non existent. It's a nightmare. Everything's a nightmare. But the treatment psychologists, the clinical psychologists like me, we haven't been involved in court involved practice for 40 years. So you've had no treatment psychologist in the courts for 40 years. You've just had these forensic psychologists who do something different. They do custody evaluations that are pointless and solve nothing, and what they call reunification therapy that doesn't exist. It's just they make stuff up, and whatever they make up, they call it reunification therapy, which is why it doesn't solve anything. And so uh, there's been neglect, wholesale neglect of the family courts by professional psychology for 40 years. So there is no treatment over here for the attachment pathology in the family courts. We have treatments for everything else: eating disorders, ADHD, oppositional defiant disorder, autism. We have treatments for everything else except the attachment pathology in the family courts. And there's reason for that. The pathology created that situation. What the pathology is, narcissistic borderline dark personality pathology, is it's a very dangerous pathology. It's delusional, persecutory delusions. It's vengeful. It's retaliatory, and it's very high conflict and high angry. Borderline and narcissistic angry is very painful. And so that's professionally dangerous to anybody who tries to interfere with what they want to do, which is us, the clinical psychologists. We're coming in trying to treat the child's attachment pathology, and they're trying to create it. So we're at odds with the pathology, and that pathology is very dangerous. It's going to attack us with licensing board complaints and false allegations, just like it attacks you with false allegations. Then we have to hire an attorney, and if there's anything wrong, we can get sanctions on our license. And oh my goodness, it's just too dangerous to work over here. So the clinical psychologist left because we don't want to put our license on the line for some narcissistic borderline dark pathology. And the family courts delay and delay. So there's no real anticipation that we're going to be effective in actually solving it because the courts actually participate in the pathology. So the clinical psychologists just all left and called high conflict divorce. That's what it was called. High conflict divorce was untreatable, is basically what the clinical psychologists view it as. And we kind of warehoused you over to forensic psychologists to maybe come up with custody issues. And then we abandon you. The forensic psychologists who should have stepped up and developed the diagnostic and assessment and treatment protocols didn't. They just went crazy making up their own stuff, and basically came up with a huge behemoth 6 to 9 month evaluation that costs $20,000 to $40,000, and they make a lot of money on, or you get nothing. And so it's just a nightmare over here. Now, one of the issues that you will be facing, you want a treatment plan. You have an attachment pathology. That's a problem in love and bonding. Child rejecting a parent is a problem in the attachment networks. It's a love and bonding problem. So you've got attachment pathology in the child. The attachment system is a primary motivational system of the brain for love and bonding. It's developing its patterns for love and bonding during childhood. And so childhood is not the time when we want to see the worst possible attachment pathology. And with all attachment pathology, we always want to repair the breach. And that's Ed Tronick and Gold and The Power of Discord, their book, and Ed Tronick's research for 40 years on attachment is we always repair the attachment thing bond. The worst possible thing we can do is leave a breached attachment bond unrepaired in childhood. That is the worst possible thing we can do. So stop doing that. Fix it. Problem is they don't know how to fix it. And so that's what they're kind of covering up for, is the fact that they don't know how to do treatment. They don't know how to fix the pathology they're working with. They don't know how to diagnose it. They don't know how to treat it. So the level of ignorance and incompetence in the family courts is phenomenal, because no clinical psychologists are here. No knowledge is over here. So now, as I look at that problem for you parents and what to do about it, we got to get you competent treatment providers over here. We have a choice. We can rehabilitate the forensic people, but I figure if they're lazy, ignorant, incompetent, and unethical to begin with, why would I want them to try to patch them and make them into something workable? No, they need to lose their license. They're colluding with child abuse because of their ignorance, incompetence, and laziness. They need to go away, and we need to get competent people, people who are motivated, people who are self-motivated, and know what they're doing. So where's Bessel van der Kolk? Is he working in the family courts? No. Where's Ed Tronick? Is he working in the family court? No. Nobody's working in the family courts in actual psychology because it's too dangerous. And so we got to get them back. And so we have to make it safe for them to come back. Otherwise, they won't come. I used to be one of them. There's no reason for me to put my license on the line. I worked all my entire life, and doctorate degree and studying it. Why should I put all of that on the line for you because you married a crazy pathological person? I should not have to put my license on the line to try to help you. But I do, because this is just a nightmare situation over here. Now, one of the features about systems, you're all worried about your individual cases. Totally understandable. That's your child. I totally get it. The problem is the systems are broken. And until we fix the broken systems, there is no solution to your individual problem. I can say, get a treatment plan, but they don't write treatment plans. I can say, get a diagnosis. They don't give diagnoses. So until we fix the system so that you can get a diagnosis and an accurate diagnosis and an effective treatment plan, there's no solution for any of you. So, over the past 10 years, Dorsey's been out there working individual families, trying to triage and get what she can accomplish. Meanwhile, I'm on the systems fixing side of things. And let me clue you in on something here. I'm leaving. I'm not arriving. Okay, look at me, old guy here. I figure I've got at most about 10 years, probably more like about 5 years on the planet, at which point I'm out of here. So, and everything becomes your problem. Everything becomes your problem at that point on, as far as I'm concerned. So, my life and orientation right now isn't really about, fixing the family court stuff. It's about leaving. Okay. It's about being an old guy, having a life, and kind of settling in. So I have a consulting practice where I'm working in the family courts, and that's going to leverage thing, and that's helping you guys one by one. But I'm more on a systems change kind of thing. And the arc that I'm working on is goes beyond me. So even when I leave, things will still be changing around me, because the issue is eventually, professional psychology has to deal with what I'm saying. And so far they've been ignoring and denying and just apathy, and they don't care. But at some point, they will have to deal with what I've been saying. And the moment they do, things will change. And the reasons will change has something to do with something called the homeostatic balance of the systems. The systems right now, the dysfunctional systems, dysfunctional legal system, dysfunctional mental health system. The reasons legal system is dysfunctional because the mental health system is dysfunctional, and the legal system tries to rely on mental health, and it just collapses out. So we have to get the mental health system functional. But the problem is the level of ignorance in professional psychology in the family courts. That's the symptom of the Dysfunctional pathology in the family courts is the level of professional ignorance and incompetence. We cannot remove the symptom because it is stabilizing a dysfunctional mental health system. If we remove the symptom of ignorance from the family courts, the whole mental health system in the family courts will collapse because there is no authentic knowledge over here. There is no attachment knowledge, no personality disorder and competence, no delusional thought disorder competence, no family systems competence. There is no knowledge or competence in the family courts. They've just been making stuff up, and the unethical practices rampant and unchecked. So we can't remove the ignorance because every aspect of the dysfunctional system will operate to keep the symptom there because it needs the symptom. And you'll see that with the Gardnerians, you'll see that with the forensic psychologists. They will be working to keep things as the status quo. So, Salvador Minuchin, there we go. Salvador Minuchin, Mastering Family Therapy. Salvador Minuchin, what he says, what do you do with a dysfunctional homeostatic balance? You can't remove the symptom, everybody knows, because the system will operate to stabilize it. Every aspect of the system will try to keep it. So the first thing you have to do if you're going to do systems change is to disrupt the homeostatic balance of the system. Homeo, the same, static never changes. The same that never changes of the system. We have to first disrupt that. And then as it starts to reorganize itself, we remove the symptom and help it move into a more functional system. So you disrupt the system, then you can remove the symptom and then help it reorganize. So what my role is to disrupt the homeostatic balance. That's my role. Okay. It's not to do anything else that you people think is my role. My role is to disrupt the homeostatic balance. And that's what I've done. I've given the people, the minds out there, the system, new information that it has to process about shared delusions, about family systems, about personality disorders, about the diagnostic checklist, 12 associated clinical signs. There's a whole bunch of new information the system has to deal with and process. When it does, it's going to disrupt the homeostatic balance of them doing the same thing the same way all the time. The moment they do that, we can take out the ignorance and we can put in the knowledge. So that's what's going to happen. But it requires that the system encounter the information of Dr. Childress. And so far, it's been denying it and avoiding it and doing all sorts of things to pretend I don't exist. That will not last forever because knowledge is knowledge. I've given it to the parents, it's into the mindscape, the psychological bloodstream. It will emerge. The only question is whether I'm still around when it does, and when they do encounter Dr. Childress, and they'll be fixing the system, 10 years from now, and I'll be a few years gone. So you'll have to do it on your own. So the only question is whether you get my help on fixing the system or whether you just do it on your own a couple of years from now. The only issue is how long it takes. That's been true since 2010. 2015, the moment I write foundations, everything's on the other side now. It's just a question of how long do people continue to reject knowledge and just kind of flail about in your ignorance. So that's the whole systems issue that surrounds you. I keep telling you, parents, we cannot solve it for any one family until we solve it for all families. The moment we solve it for, the system, we solve it for all children and all families everywhere. So, that's the situation. Now, from your individual perspective, though, I realize you've got a kid, there are several kids, and you're really worried about them. You are the protective parent. You're activated into seeking to protect your children from the psychological abuse that they're obviously enduring and the destruction of their lives by this pathological ex-spouse and parent. And so you're trying to protect your children and try to establish for your children a normal range life. I totally understand. The advice I would give you is you need a treatment plan to fix the attachment pathology with your children. Now, you won't be able to get one because the mental health people around you are ignorant and incompetent. They don't know how to do treatment plans. They don't know what the pathology is. They're just the worst imaginable. So, what good is it for me to tell you what you need to do if you can't do what you need to do? You need a treatment plan. For that, you need a diagnosis. Start there because, well, actually, start with the treatment plan. Step two is a diagnosis because if you just get focus on the diagnosis, we still need a treatment plan at the end. So go all the way to the end. You need a treatment plan. For that, you need a diagnosis. The diagnosis or the treatment for cancer is different than the treatment for diabetes. Now, I am absolutely amazed that I need to explain that to people, but I do, because that's the level of abject ignorance in the family courts that I'm out there saying the treatment for cancer is different than the treatment for diabetes. So you need a diagnosis before you go into treatment. And that's the critical issue. If you try to go into treatment, reunification therapy, well, we need a treatment for my child. Okay, fine. What are you treating? Are you treating cancer or diabetes? And that's critical here because the diagnosis, the accurate diagnosis for the pathology in the family courts is child psychological abuse by the allied narcissistic borderline dark personality parent. The treatment for child abuse is not a treatment plan, it's a safety plan. For all dangerous pathologies, there's three of them: suicide, homicide, and abuse. For all of them, we don't enter a treatment plan. We start with a safety plan. For spousal abuse, make sure the spouse is safe and protected. Then we can move into treatment. Child abuse, make sure the child's protected. Suicide, make sure the person's safe. Then we can start our treatment. But it always starts with a safety plan around the dangerous pathologies: suicide, homicide, and abuse. And this is one of them. This is two of them, actually. Child abuse, psychological abuse by the allied parent, or child abuse by the targeted parent. Those are the only two causes of attachment pathology. So we got child abuse. And it's spousal abuse of the targeted parent using the child as a weapon. So we got two dangerous pathologies here. And the for the child abuse is the more focal point because I have an adult and I have child abuse, and child is devastating. So that's of the two abuse dangerous pathologies, child abuse is the one that takes priority on the treatment plan or safety plan. So and the treatment for child abuse is a protective separation from the abusive parent. There is no therapy that I will ever do for child physical abuse that will be effective if I send the kid home to be physically abused by the parent. There's no treatment for sex abuse that's going to be effective if I send the child home to be sexually abused. The first thing we have to do for treatment is to protectively separate the child from the abusive parent. Think about it. If I'm trying to restore that child's bond to the targeted parent, and I have the allied parent trying to keep that child pathological, I'm trying to do one thing with the allied parents trying to do one thing, and they're trying to do something else. We're just going to rip that child apart. And the pathological parent's fine with that. They're fine ripping the child apart. Treatment providers aren't. So we have a choice. We can either not do the treatment, which is what our choice right now. We've just left and said, we're not doing the treatment because otherwise we're going to have to rip the child apart. Or we can get the protective separation that we need so that we can then restore the child's healthy development. Then we restore with the pathological parent. Keep it the way we treat all child abuse issues. We protectively separate, restore the child's healthy development, and then reintroduce the abusive parent with enough safeguards in place to make sure the abuse doesn't resume. That's what we do with all child abuse. That's what we have here. We have a child psychological abuse diagnosis. So until we obtain the accurate diagnosis of child abuse by the allied parent, there is no treatment plan that will be effective for the pathology. We will be treating cancer with insulin, and the patient will die from the misdiagnosed and mistreated cancer. We need to treat the cancer with chemotherapy, and poof, we can get rid of the cancer. And actually, it's really easy to do. Dorsey can recover healthy child development in the worst of cases of this pathology within a matter of days using a non treatment oriented approach. It's a different approach of just kind of reestablishing normal systems for the kid rather than fixing problems. It just kind of pops the normal back into place for attachment and stuff. It's a very interesting, very elegant kind of approach to doing it, and it solves the situation really easy, which indicates how easy it is to solve. But it needs the protective separation. The high road needs the protective separation period. We need an accurate diagnosis of the pathology. The moment we get that, fixing it is easy peasy. But it's impossible if we're treating cancer with diabetes. Now, one of the features about the mental health people is once this shifts and they realize that this is child psychological abuse diagnosis, a shared persecutory delusion, factitious disorder imposed on another, imposed on the child. Soon as that enters their understanding, they're going to realize that they've been colluding with the child abuse and incompetent for the past 40 years. So all these forensic psychologists with the big Vitas and stuff and been working in the family courts, all of them have been unethical violations to 2.01. They've misdiagnosed the pathology for 40 years. They have just been colluding and participating in the child abuse in the family courts for 40 years. Them, individually, them. They're not going to like that self-awareness. So there's going to be a whole push to keep that out of awareness that this is actually child abuse. But it's going to come, it's a shared that's the truth. It's a shared persecutory delusion. That's a truth. If you look, you see it. There it is. And that's child psychological abuse. If you look, you look. And so it will come. It's just how much resistance does that have in entering the awareness of professional psychology? The moment it does, holy cow, then there's going to be all sorts of changes. The difficulty, though, is when that happens, the awareness that comes with that is that none of them are competent. None of them have competence in attachment pathology. They don't know how to fix it. None of them are competent in delusional thought disorders. They don't know how to diagnose it. So all of a sudden, you have no professionals in the family courts who are competent. The professionals who might be competent in personality disorders or dialectic behavior therapies, they won't work in the family courts. It's too dangerous. They'll say no. And plus, they're not competent with the pathology in the family courts. They know personality disorders. They don't know the attachment pathology in the family courts, and they don't know attachment pathology. So they'll say, no, I'm not coming over to work. Or family systems therapy. I don't know attachment pathology. I don't know this delusional thought disorders in the family courts. So I'm not coming. And rightly so. So the clinical psychologists won't come because they're not competent. And they know that. The forensic psychologists will have to leave because they're not competent. And so the 40 years of neglect of the family courts by professional psychologists is going to catch up with them. And there's going to be no mental health treatment in the family courts. Yikes, that's a mess. That's disrupting homeostatic balance. And so from my perspective, that's what we're kind of going into is an absolute mess. How do we fix it? I have no idea. It's not you apply knowledge. I tell them how to fix it. They don't listen to me, so I don't know what they're going to do, but we're looking to head into an absolute nightmare mess in terms of professional psychology in the family courts where there is zero competence anywhere. Once they kind of process what the problem is, the solution out is the diagnostic checklist for pathogenic parenting, the parenting practices rating scale, and the parent-child uh, relationship rating scale. That the attachment-based model of parental alienation and what I recommend to do with all of that is the path out. But I don't want to fight about it. I'm not going to fight about it. When they want the path out, there it is. Um, but right now, it's just a nightmare. So I'm going to let them have their nightmare until they kind of find the motivation, and that's what it is. It's just simply a motivational problem. They just don't care. They're not motivated. One of my favorite sayings is, "Don't try to teach a pig to sing. It just frustrates you and annoys the pig." So I'm not here to teach pigs to sing. What I'm doing is my consulting practice is I'm basically Professor Childress grading papers and given the grade of F, which could potentially mean the loss of their license. So hopefully that will generate some motivation by them. The issue becomes for you parents focused on your situation and your child. How do you get professional services and treatment for your child in this nightmare of a mess with systems and broken systems? I don't know. If I'm honest, I don't know. Talk to your legislator, talk to your mental health people, talk to everybody that there's no mental health services in the family courts, no competent mental health services. We'll see what happens. Eventually, somebody will care. Eventually, the solution is to develop a standardized diagnostic assessment protocol and standardized treatment protocol for the family courts so that it will be safe for the clinical psychologists to work here. And that's the pilot program for the family courts could do that. But we're waiting, and okay, so when eventually they get around to it, then we can start moving on helping your families in your situation. A patient should never, ever, ever have to explain a pathology to a doctor. Okay, so if you find yourself out there having to explain a pathology to a doctor, that shows how absolutely low quality the professional services you're receiving in the family courts, that you have to explain the pathology and its treatment to the doctors. So, practicality, what do you do? I suggest you go out to competence and recruit back to the family courts. They might be a little uncomfortable about coming back to the courts. Tell them it's about therapy, not custody, that you need a diagnosis, and educate them about the pathology. I have a consulting website, send the mental health people to the mental health consultation page. I'll explain it to them. I'm more than happy to explain it to people. I'm more than happy to help whenever they want the help. They don't want the help right now. So I don't know what to tell you about that. You have ignorant, incompetent, lazy, unethical forensic psychologists all around you. You have no clinical psychologists who work in the family courts and no one in professional psychology, not the APA, not the AFCC. No one cares about that situation. Where are the licensing boards enforcing ethical standards? Nowhere to be seen. So, where are your legislators overseeing this whole situation? And why aren't the licensing boards enforcing ethical standards? Why can't you get competence in the family courts? It's a mess. It's a mess. What do you do? I suggest triage that you get out to dialectic behavior therapists. There's a couple of reasons for that. One is they're trauma psychologists. They work with borderline. They work with suicidality on the borderlines. They're not timid psychologists. So they have the best chance of coming back to work in the family courts around child abuse and spousal abuse pathology because they are not timid psychologists. And they have a structure they bring with them, dialectic behavior therapy that will keep them safe. We need the diagnosis from them. And then the treatment would be a modification or the adaptation of dialectic behavior therapy for the family courts. What dialectic behavior therapy is by Marsha Linehan at the University of Washington for borderline personality pathology. And what it is a combination of cognitive behavioral therapy, CBT, with mindfulness and then some skills instruction. And but the two big ones are the mindfulness and the CBT. Now, the CBT component will be good for several reasons. One, the cognitive behavioral of that challenges irrational beliefs. That's your delusion. So we're going to challenge the delusional beliefs from the cognitive perspective of CBT. Then the behavioral perspective is applied behavioral analysis using behavior chains and the behavior chain interviewing. And so they bring this knowledge of applied behavioral analysis, and that, if applied, can determine whether a conflict, parent-child conflict, is authentic or not. Is it an authentic conflict or is it an induced conflict? And applied behavioral analysis can figure that out by identifying what's cueing the behavior. If it's an authentic one, then it's under the cue of the targeted parent. So when we change the targeted parent's behavior, we see a change in the child's behavior. If it's inauthentic, then we change the target behavior and nothing changes in the child because it's not being cued by the targeted behavior. It's not authentic. So an applied behavioral analysis can identify authentic from inauthentic. The cognitive portion of therapy can challenge the irrational beliefs of the delusion. In addition, though, what's more fulsome about DBT is the mindfulness component out of Eastern meditative traditions. That will help the child reduce the stress. They're in the middle of the situation. So, learning these skills for reducing that stress will be helpful for the child. In addition, the mindfulness helps teach the child how to discover their own self authenticity. And that's what we need in the invalidating environment of the narcissistic borderline. Marsha Linehan, invalidating environment. We need our treatment to support the child's healthy self authenticity. So, between the mindfulness and the CBT, we can get that. It needs to be the family therapist who's meeting once a week with the child and the or children and the targeted parent to help stabilize things. Now, for all therapy, all therapy, we need outcome measures. All therapy needs outcome measures. Now, in clinical psychology, we do this all the time. We collect outcome measures, and that's just standard of practice. In forensic psychology, never have I seen an outcome measure. You know why? Because they don't fix anything. They are incompetent. And so there is no outcome. Everything is awful. So they just don't even bother to document that they're unsuccessful on everything. So ask any treatment provider, any forensic psychologist, anywhere. Say, what's your outcome measure for your treatment? They'll say, I don't have one. What an outcome measure? So what I've given you as your outcome measure, it's a good one. And that's what psychologists do. We create these instruments and stuff that we need. So what I've given you is, I call it the parent-child relationship rating scale. Easy peasy. A 1 to 7 rating. It's called a Likert scale. 1 and 2 are awful. 6 and 7 are wonderful. 3, 4, 5 are normal range. And you rate the targeted parent rates the child on 3 items every day: affection from 1 to 7, cooperation from 1 to 7, and social involvement from 1 to 7. Then you get those 3 numbers every day rating for the child. You email them to your family therapist, your DBT therapist, and they put it in an Excel file. Now, during the weekly sessions, you talk about the week's ratings, and if there's any problems, you talk about what happened, applied behavioral analysis, work out the cue structure, little processing from emotionally focused therapy about attachment communications, helping them learn the skills of conflict resolution and effective communication, making I statements, all those kinds of stuff, skills instruction, as well as balancing out what's normal, balancing out a healthy hierarchy. Parents are in charge, not children. However, we also listen to children and help negotiate a resolution to the conflict. Edtronic breach and repair sequence. So that's what happens in the family therapy with the DBT therapist. And it centers around the outcome measure. So you come in and you say, wow, Michael, you had a 2 last week, on Tuesday. What happened here? And then Michael explains and mom explains what happened in the situation. And you begin to work it out. And you begin to, you know, verify that that's really a 2. Maybe mom's being a little harsh. Maybe, and so you work out what's normal range and you discuss it and you come together. That's the therapy. That's the family therapy that needs to occur. The reason I'm recommending DBT therapists is because they bring knowledge, but we need to get them back into the course. They will not know attachment pathology. They will not know delusional thought disorders. They will a little bit from the borderline, but we need to up that ability within the forensic people or within the court system. Court involved psychology, the ability to recognize and diagnose persecutory delusions is a critical professional skill set in the family courts. That's not currently present anywhere. So, and so that's what I recommend is looking out to the DBT therapist. Now, for the dads out there, targeted dads, you're most likely in the borderline mom pattern. So the dialectic behavior therapist will recognize the borderline pathology of your ex. So that's another advantage. For the moms, you have a narcissistic dad. So the borderlines don't work with narcissistic dads so much because nobody really does. Narcissists never show up for therapy. The narcissistic pathology is the abuse pathology, where you will find therapists experienced with narcissistic pathology is in child abuse and spousal abuse. Child abuse ones, you won't find them out here. Those are in the CPS domain mostly. So look to the spousal abuse therapists. They're the ones who will recognize narcissistic pathology. So that's what I recommend for targeted moms is to look over in the domestic violence community. Now, the actual professional term for domestic violence is intimate partner violence, IPV. And that's you will want a professional who organizes around that construct, IPV, rather than domestic violence. Why? The research on there's no good definition of domestic violence. The definition is of intimate partner violence that has definitions. So we have research on the different aspects of intimate partner violence and features of it. The research on domestic violence is soft and kind of crumbly. And so we want to move over to the established knowledge. One of the critical issues on IPV is a distinction between what's called situational IPV and terrorist IPV. Situational intimate partner violence is when two people, the situation gets a little out of hand and there was some pushing, shoving, some physicality to it. And it's deeply unfortunate, but it's not a characterological trait. It was just two people got locked up and things got out of hand. It's situational. The moment we calm that situation or get these two people separated, they are not dangerous humans in and of themselves. It was a combination and the situation. That's situational IPV. The other is terrorist IPV. That's the one we're concerned about. That's that narcissistic, dark pathology, typically dad, who is controlling, hostile, aggressive, demeaning, just the cruelty of the narcissistic personality. That's the terrorist IPV. That's the one we're looking for. So when there's allegations of domestic violence, we need a professional who knows to kind of come in and kind of settle things down because the allegation could be around false allegations from a borderline who sees everything as abusive or something. And so we need professional eyes with competence on the situation. Whenever there's a dangerous pathology, three of them: suicide, homicide, abuse, child abuse, spousal abuse, and elder abuse. Those are dangerous pathologies. Whenever there's a dangerous pathology, whenever there's a possibility of child abuse, our diagnosis needs to be accurate 100% of the time because the consequences for misdiagnosing child abuse for the child are too devastating. So we have to be accurate 100% of the time. And the differential diagnosis in the family courts is child abuse by one parent or the other. Severe attachment pathology. It's either targeted parent causing it, two-person attribution, or it's the allied parent psychologically abusing the child and creating a false attachment pathology for secondary gain, a three-person triangle attribution. We need to know which one that is. There are ways we can do that the moment we ask the question, but that's the feature right now is we need to get over doing a proper risk assessment for possible child abuse, and they're not. So look to the DBT therapist, look to the um, IPV therapists for moms. The other possibility you have is internal family systems therapy. That'll give you the family systems component, and it brings Gestalt therapy that'll give you an integrative component. But you're going to need the child abuse diagnosis out of them, and they're they may not because they don't work family courts. They don't know the pathology in the family courts, and they don't know delusional thought disorders or attachment pathology either. So, internal family systems is another one that I will be like recommending be brought over, as well as emotionally focused therapy, but that's Rogerian, it's not directive, and they say we're not for dangerous pathologies, and they're right, they're not for dangerous pathologies, and this is one. So emotionally focused therapy is going to have its limitations. But it's attachment pathology, adtronic, breach and repair, excellent. It needs to be brought over principles from that. But the dialectic behavior therapy is your core to get into the family courts and bring over as an adaptation. Now, for you parents out there, you say, well, how do I get a diagnosis? Do I have to go to court to get a court order to get a diagnosis or risk assessment for possible child abuse? Actually, no, you shouldn't, because it is the responsibility of all mental health professionals when they encounter a risk pathology to conduct a proper assessment or ensure that one gets conducted. So if we run into suicides, a patient says, I'm suicidal, we have a duty to protect obligation that gets triggered when the patient says, I'm suicidal, that we have to conduct a proper risk assessment for suicide or ensure that one gets conducted. So we might refer them to the ER, or we might do the assessment ourselves, and we're trained to do that in our course material and stuff. Have you ever tried before? Have you have a plan? Do you have means available? All these, any history in your family, all these questions we ask to assess suicide risk. Same with abuse. Now, for abuse, for a low threshold of a suspicion of possible child abuse, just a suspicion, and it just has to be a possible child abuse, we are mandated to report over into CPS for physical abuse, sexual abuse, and neglect abuse. We're not even allowed to investigate them because I've worked foster care, because we want to protect the forensic evidence. So if I get a suspicion, oh, I'm looking at possible child abuse here, I want to get that over to CPS so that they can conduct a clean assessment of the child's reporting and the child's situation, so that if there's abuse, we can protect the forensic evidence and we can get a prosecution on the abuser. That's why we have mandated reports. That's why psychologists are not allowed to do an assessment for physical, sexual, or neglect abuse, because we'll just mess with it if we do it wrong. Let's get it. This is too important. Let's get it over to trained professionals at CPS to assess for those forms of child abuse. Psychological child abuse is in the DSM, but it's not a mandated report because it's too complicated for CPS. CPS can't figure that out. Their social workers are trained with the gritty sex abuse and physical abuse and meth moms and neglect and just the nasty stuff of our society. Psychological abuse is just too iffy for them to. So it's not a mandated report, which means the psychology people are then allowed to do the assessment. In fact, not only allowed, we're required by our duty to protect obligations to conduct the assessment or to ensure that a proper risk assessment for possible psychological child abuse is conducted. That's our duty to protect obligations. Every one of them has duty to protect obligations. In addition, any any treatment provider, in order to provide treatment, they have to diagnose what the pathology is. Are they treating cancer or diabetes? They have to know that for their treatment plan. So, any treating professional, mental health professional, should diagnose what the pathology is they're treating. Are you treating cancer or diabetes? If they don't know how to assess for the pathology, then they're incompetent. They should be going working with something else, or they should seek consultation with somebody who is competent. That's required kind of practice. They're not. They are misdiagnosing the pathology. They are practicing beyond the boundaries of their competence because they can, because the licensing boards don't care about competence for your families. They just allow them to do whatever they want to do and destroy your child and destroy your family's life. Okay, so the question, who do I get to do an assessment? The answer is anyone. That's the truth. But now you're just faced with the massive level of incompetence in the family courts. So you don't have anyone because no one is competent in the assessment of delusional thought disorders. No one's competent in that's a mental status exam of thought and perception. No one's competent in the assessment of attachment pathology. Or they're not competent personality disorder pathology, family systems, complex trauma, and child abuse. Most of the forensic people work in the courts. They've never worked child abuse. They don't know what actual child abuse looks like, and it doesn't look like what the child's presenting in the family courts. When an actual child abuse victim, does not look like what the child does in the family courts because it's a false attachment pathology in the family courts many times. There are cases of actual child abuse. Yes, that exists. Dogs exist, cats exist. And the existence of dogs does not mean that cats don't exist and vice versa. They both exist. Both have fur, four legs, and a tail, but we can tell them apart if we know where to look. And so we need to identify actual child abuse by the targeted parent from inauthentic child abuse, a factitious attachment pathology being imposed on the child by a narcissistic, borderline, dark personality parent. We need to identify both of those 100% of the time with accuracy. If you believe a shared delusion, you become part of the shared delusion. You become part of the pathology. When that pathology is child abuse, you become part of the child abuse. When it's spousal abuse, you become part of the spousal abuse using the child as a weapon. So, these mental health people around you, if they misdiagnose the pathology because they are ignorant and incompetent, they become child abusers and spousal abusers because they are ignorant and incompetent. They get caught in this role that serves their own emotional needs. The protective um, other in the situation, the virtuous protector. That's the role. The virtuous protector is the mental health person. I'm so wonderful. I'm going to protect the child from the abusive parent. Problem is that parent's not abusive, and this one is, and you're colluding with the abusive parent to protect the child from the healthy parent because you believe a shared delusion because you got caught in your virtuous protector desire. So if you're going to work the family courts, you really need to know what this pathology is. You need to know about dark personalities and borderlines and narcissists and delusional disorders and persecutory delusions and the mental status exam of thought and perception. And the brief psychiatric rating scale. Item 11, unusual thought content, is for rating delusions. We should bring that into the family courts. Why hasn't that been here for 40 years? A brief psychiatric rating scale. Item 11, unusual thought content. If the person acts on the delusion as if it was true, that indicates full commitment to the belief, full conviction. And at full conviction, that's the difference between a rating of 3 and a rating of 4. Rating of 3, there's not full conviction in the false belief. That's relatively normal range still. If there's full conviction in the false belief, it goes to a rating of 4. Now it's a delusion, encapsulated delusion at a 4 with no impairment of functioning and no preoccupation. Well, there is impairment of functioning and there is preoccupation, so it goes up to at least a 5 on the BPRS. Item 11, unusual thought content. So it is at least a moderately severe persecutory delusion in the family courts based on the brief psychiatric rating scale. The oldest, most widely used measure of the scale for rating psychotic symptoms, BPRS. Is it used? No. Ignorance like a rock. So, um, so for treatment, I understand that parents, you're very worried about your situation, your child. Absolutely. You're the protective parent. You're trying to protect your child. I'd recommend you kind of get over into Dorsey's world, and absorb her information. Higher purpose parenting class is good. You may want to consider a trained coach out of there, but we still need a diagnosis of the child abuse for treatment. That's just we need to fix things. We need a treatment plan. For that, we need an accurate diagnosis. The accurate diagnosis, child psychological abuse by the allied parent. The mental health people are not stepping up to their duty to protect obligations, and as a result, they are failing to protect the child because they are failing to make an accurate diagnosis of the child abuse, because they're not competent in the assessment and diagnosis of the child abuse, the shared delusional disorder and attachment pathology. So, to the extent that parents in your generation can hold these mental health people accountable for their incompetence, then that's a good thing because it will inspire motivation to become competent. To the extent that you can get your legislators to look at the licensing boards and why licensing boards aren't enforcing competence standards, that would be good because it will get the motivation for them to be competent. Um, but we're still going to be faced with the problem of we get rid of the incompetent ones, but the clinical psychologists will not work in the family courts until we make it safe for their license. Okay, so that's going to be the little knot that holds things up for a little bit, that you're not going to be able to find any mental health people in the family courts, any competent mental health people, any mental health people. The incompetent ones are going to flee. It's too dangerous. And the competent ones won't come, especially now that it's so dangerously over inflamed in the family courts where everybody's in danger, even the forensic people. The clinical psychologists are going to say, I'm not touching that with a 10-foot pole. That's my license on the line. That's my career. That's my family. That's my house payment, my car payment, my stress at night. I'm not going to work in the family courts. I'll go work ADHD or eating disorders, substance abuse somewhere else where they want me. Okay, so that's going to be the situation. My recommendation on the diagnosis is the diagnostic checklist for pathogenic parenting and the parenting practices rating scale. Ask them to complete those two. There's a checklist, diagnostic checklist. Can you please rate the child's symptoms and whether these 12 associated clinical signs? They will say no. The mental health people will say, no, I'm not going to tell you what the symptoms are because they're ignorant and incompetent. Incredible that they will say no. You say, I'd like this checklist completed, and they will say, no, I'm not doing that. That's incredible. Makes my head explode for any doctor. But they do that and they're allowed to get away with it. Parenting practices rating scale. They're accusing you, the targeted parent, of being problematic in your parenting somehow. Document it, please. parenting practices rating scale, 4 levels. Level 1 and 2 are abusive range, level 3 and 4 are normal range. Please tell me where my parenting falls so that we can fix whatever problem there is and we can fix the child's attachment pathology if I'm the problem. Tell me what my problem is. Parenting practices rating scale. If you are a normal range parent, level 3 and 4, then you cannot possibly be creating the severe attachment pathology in the child. Level 3 and 4 parenting create, or level 3 parenting, problematic normal range, creates an insecure attachment that more strongly motivates the child to bond to the problem parent, not less, more. So, if you're a level 3 or 4 parent, you cannot be producing the severe attachment pathology. So, diagnostic checklist for pathogenic parenting. Tell me if these symptoms are present in the child. If they are present in the child, they need an explanation, and there's only one possible explanation for that set. They can try to explain them some other way, but just tell us, are these symptoms present? If they are, they need to be explained. Yes or no, are they present? The idea that they won't tell us is insane. Tell us what the targeted parent, their parenting is. 4 categories. Tell us where there's a problem so we can fix it and there won't be a problem. But they won't tell us that either. So those are the 2 instruments that will absolutely, if you get those 2 instruments, I will absolutely diagnose this pathology in the family courts, the shared delusional stuff, 100% of the time with no misdiagnoses. Those 2 instruments, diagnostic checklist, parenting practices rating scale, will 100% identify the pathology and will never misidentify it. Try it. Try it out. You think it's not true? Try it out. See if it's true. Collect those 2 measures and see what happens. Disrupt the homeostatic balance. The moment they start collecting the information, they're going to look and they say, holy cow, the information is right there. We have narcissistic traits. We have a delusional disorder in the child. We have like crazy attachment pathology with a normal range targeted parent. The moment they look, they'll see. So look, checklist, check, 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 little boxes, simple, easy peasy. So that's the situation on treatment. We need to first protect the child. We cannot ask the child to reveal their authenticity until we can protect them. Until I can protect the child, if I get that child to bond to the targeted parent, that child's going to face a withering retaliation from the pathological, narcissistic, borderline, dark personality parent. We must first protect the child with all cases of child abuse. This is a diagnosis of child abuse. We need to start making the diagnosis and protecting the child. We can fix it easy peasy. We don't need years of conflict going on because we are protecting the pathological parent. No, diagnose the child abuse, protect the child, fix the problem, and give the child a normal, range and healthy childhood. But the mental health people are failing. The systems are broken, and we cannot fix the situation in any one family until we fix it. The system, which will fix it for all families everywhere. You don't need to prove a pathology to anybody, to a judge, to the mental health. We just need the mental health people to do their job. They have a duty to protect your child. They have a duty to protect you. They have a duty to inform the court of child abuse and spousal abuse when it is present. They are massively, massively failing in their duty to protect obligations because they are ignorant, incompetent, unethical, and lazy. And the licensing boards and the AFCC and the APA don't care. They've abandoned you, and it's an absolute mess. So with that, I'm headed off to my Sunday. Not a very optimistic thing on treatment. We'll see what we can do out there. I'm available for consultation. If you find somebody with motivation, That's all it takes. Any mental health professional can step up, give that diagnosis of child psychological abuse. The only thing that is missing is backbone. The backbone of the mental health profession. That's the only thing. That's what my role is. I give them backbone to do the right thing, to make that child abuse diagnosis when it's warranted, and to step up and advocate that we protect the child. That's what we do. We're psychologists, we're mental health people, we're doctors. We always protect the child. So we need to start doing that, and that will solve the situation for parents. Shouldn't be up to you to solve it. That's our job as psychologists to solve it. We need to start doing our job. Then you can start relaxing because you don't have to solve everything. The professionals are doing their job. So, with that, we'll talk with you next week. Good luck, everybody. Bye bye.